By overexposure to the sun, a sun lamp, or overexposure to radioactivity, although this is extremely rare. We can avoid overexposure by covering the skin with clothing and wearing sun cream. If you think somebody may have been sunburnt, there are 3 things to look for: reddening of the skin, pain in the area that's been burnt, and blisters. Encourage them to take sips of cold water. Cool the area down by sponging them with cool water, or soak the sore skin in a bath or a shower for no longer than 10 minutes. You can repeat this if it helps ease the pain. If the burn doesn't blister, then the sunburn is mild and you can treat with calamine lotion or after sun to soothe the sore skin. If there are blisters or other skin damage, then the burn is severe and they will need to see a doctor. You will also need to look out for symptoms of heat stroke and heat exhaustion, as these can be life-threatening. Remember, cover the skin, take sips of cold water, cool the skin. If there's no blistering, then use calamine lotion or after sun. If there is blistering, seek medical advice. And that's how we treat somebody who's suffering from sunburn.
Dehydration occurs when the amount of fluids lost from the body is not adequately replaced. It is mainly the result of excessive sweating through sporting activity, hot temperature or fever, but can be caused by diarrhea and vomiting. There are 4 signs of dehydration to look for: headaches and lightheadedness, dry mouth, eyes and lips, small amounts of dark urine, muscle cramps. If someone is dehydrated, help them to sit down and give them plenty of water to drink. Giving them an oral rehydration solution to drink will help replace the salt and other minerals which they've lost. You can buy rehydration sachets from the pharmacy. If they have any painful cramps, encourage them to rest and then help them stretch and massage the muscles that hurt. Keep checking how they're feeling. If they still feel unwell once they're rehydrated, then encourage them to see a doctor straight away. So remember, when you're treating dehydration, help them to sit down, give them water, give them an oral rehydration solution, encourage them to see a doctor if it doesn't go away. And that's how we treat dehydration.
If after performing the primary survey, you find someone who is unresponsive and not breathing normally, call for help. Ask someone to call 999 or 112 and ask them to bring an AED if one is available while you begin CPR immediately. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR as soon as possible. You will need to start with chest compressions. Kneel down beside the casualty's chest. Place one hand centered on the chest and place the heel of your other hand on top and interlock your fingers to lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest to 5 to 6 centimeters. Release the pressure, allowing the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, you can sing "Staying Alive." After 30 chest compressions, you need to give rescue breaths. If you have not been trained or unwilling or unable to give rescue breaths, continue with chest compressions only until help arrives or the casualty becomes responsive. To give rescue breaths, make sure the airway is open by tilting the head back with one hand on the forehead and 2 fingers under the chin. Pinch the soft part of the nose and allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 2 rescue breaths like this. Continue to alternate 30 chest compressions and 2 rescue breaths. If someone can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruption to chest compressions. If there's someone there who can help, if they have brought you an AED, ask them to turn it on and follow the instructions while you continue CPR. Continue CPR until emergency help arrives and takes over. The casualty starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally, again, place them in the recovery position, monitor them, and prepare to start CPR again if necessary. So remember, if you come across an adult who is unresponsive and not breathing normally, call for help. Ask the caller to call 999 or 112 for emergency help and ask them to bring an AED. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR. Give 30 chest compressions, followed by 2 rescue breaths. Continue giving 30 compressions and 2 rescue breaths until help arrives or they become responsive. If an AED is available, continue CPR while the instructions from the device are followed by your helper. And that's how we perform CPR. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk if you found someone collapse. The initial assessment is called a primary survey. This is a quick, early assessment to establish how best to treat a casualty in order of priority. We can use the initials Dr. ABC or DRABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. So, when I see a casualty, first, I'm going to check for any danger to make sure it's safe for me to approach them. I don't want to become a casualty myself. Then I'm going to see if I can get a response from the casualty. As you approach, introduce yourself. Ask them questions to try to get a response. If they're not alert and do not respond to your voice, kneel down beside them and gently shake their shoulders. Hello, Amy. It's Winston. Can you hear me? Open your eyes. Still no response? You can pinch their earlobe to see if they respond to pain. Depending on how the casualty responds to you, will establish a level of response. We use the AVPU scale, and each letter can represent the casualty's level of response. A. Alert. V. Response to voice. P. Response to pain. And U is the casualty unresponsive to stimuli. If there's still no response, they are unresponsive. We need to check the airway. Is the casualty alert and speaking to you? You know that there's no problem with the airway, it is clear. If the casualty is unresponsive, open the airway by putting one hand on the forehead and gently tilting the head back with 2 fingers under the chin. Now we need to check to see if they are breathing normally. We do this by placing our ear and cheek over their nose and mouth, looking down the body to see if the chest rises and falls. We do this for 10 seconds. If the casualty is not breathing normally, call for help. Ask them to call 999 or 112 for emergency help and bring an AED. If you are alone, call for emergency help using a mobile on speakerphone and begin CPR with chest compressions. The casualty is breathing normally, so I'm going to check their circulation. Are there any signs of severe bleeding? Look and check down the body. If you find severe bleeding, try to control the bleeding to prevent life-threatening shock. Call 999 or 112 for emergency help before continuing to treat the casualty. You may also need to treat them for shock. I've established that my casualty is not bleeding. So remember, to do a primary survey, follow the order of Dr. ABC. Complete each step in that order as quickly as possible, dealing with any life-threatening conditions as you find them. Call for emergency help. Call 999 or 112. And that's how we perform a primary survey. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk.
If you ever find your baby is not responding to you, you will give them the best chance of survival if you know what to do. If you have found your baby unresponsive and not breathing normally, you will need to perform baby CPR. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. So remember, if your baby is unresponsive and not breathing, call for help. Ask a helper to call 999 or 112 for emergency help. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. Give 5 initial puffs covering both the nose and mouth, then 30